Welcome. Thank you for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Today's program is part of our Disability Education Series, a special collaboration between the Blum Center and Council on Disabilities Awareness at Mass General. Before we get started, I just want to go over a few items with you all. Please note that ASL interpretation and live captioning are provided for today's session. This session is also recorded for educational purposes. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that you are in listen-only mode. Everyone has been muted so we can hear our guest speaker today. If you have any questions for our guest speaker, you may use the chat feature, which is located at the bottom of your screen. We'll have time for it in the end. Only Blum Center staff, our co-hosts and guest speaker will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. Okay, so next I would like to introduce you all to today's guest speaker. Joining us today, we have Dr. Stephanie Santoro. Dr. Santoro is the Director of Quality Improvement Research at the Mass General Hospital Down Syndrome Program. She is also an assistant professor in pediatrics at Harvard Medical School. As a pediatrician-trained clinical geneticist, she has devoted her career to the health of individuals with genetic syndromes. Down syndrome is her primary genetic syndrome of focus, an area of clinical expertise to which she is passionately dedicated. In recognition of Down Syndrome Awareness Month, she joins us today to give a talk on Down syndrome. So please join me in welcoming Dr. Santoro.
Thank you so much for that introduction. Let me just pull up my slides. I'm really honored and excited to be here with you all today. And thank you for the invitation from the Blum Center. So today I'll be talking about current updates in Down syndrome. You heard my introduction. So my training is I attended the University of Cincinnati College of Medicine and residency at Cincinnati Children's Hospital. I've been at MGH for 5 years now, and I'm really honored and pleased to work in the Down syndrome program with the large team you see here in the photo at the bottom. This is my disclosure slide. I don't have anything in particular to disclose, but I'll mention some of the groups that I volunteer for or I receive research funding from. So today I'll quickly talk about Down syndrome. I'll provide some updates about health supervision in pediatrics, medical care for adults, and share a lot of resources. And really the goal of my presentation today is to learn about Down syndrome, but also to really celebrate individuals with Down syndrome. October is Down Syndrome Awareness Month, and this is a slide from the National Down Syndrome Society. And you can see some of the information about Down Syndrome Awareness Month here. The goal is to really raise awareness and to celebrate individuals with Down syndrome. This is a mantra in the Down syndrome community and in many communities, the idea of nothing about us without us. So today during my presentation, I have a few slides highlighting a handful of individuals with Down syndrome. There are over 200,000 individuals with Down syndrome who live in the United States. So this is just a few. I could have picked many, many other people, but this is just a couple individuals to highlight. So the first one is Kayla. She's a self-advocate and the manager of grassroots advocacy at the National Down Syndrome Society. She does a lot in the political landscape, sharing her perspective on DC politics. And she has a podcast where she talks about that called Kayla's Corner. She is the first registered lobbyist with Down syndrome. And I really like this quote from her that ends with the idea of nothing about us without us. Down syndrome was first described back in 1866 by Dr. John Langdon Down. He was one of the first physicians to describe some of the physical features and some of the characteristics of this condition. And when I talk throughout the presentation, the right words and right nomenclature to use is Down syndrome, capital D on the S, lowercase, and then no apostrophe. So just to get the naming right. And a bit more on naming. Throughout the talk, I'll use people first language because we all know that words really matter. And so people first language is trying to put the person first and their descriptive diagnosis second. So here are some examples like person with Down syndrome, child with Down syndrome, baby with Down syndrome, and a little bit more on people first language in this kind of text right here from the Massachusetts Down Syndrome Congress. This is the second person with Down syndrome to highlight. She's an actress. Jamie is an actress and model. She's performed in film, television, and theater. She has been in the well-known FX series American Horror Story. And in 2015, she was the first woman with Down syndrome to walk the red carpet at New York Fashion Week. So I thought that was really amazing and exciting. So I wanted to share this short, just 1 minute video with Jamie talking about fighting the use of the R word and talking about not limiting individuals with Down syndrome.
Don't limit us. Don't limit me. Low. Something like that. Something like that. I continually fight. It's on the street and from people that even though they may be teasing about it sometimes the individual that's faced with that takes it personal. And I step in, I'm like, hello, even though you may be teasing about it, stop. Get resistant to that term. I was part of a governmental affairs committee that changed the R term to intellectual developmental disability. It's for the awareness as well. And getting up to the White House and saying, we need this term abolished globally. That's how strongly I fight.
Great. So kind of reviewing some of the basics of Down syndrome. Down syndrome is due to an extra copy of chromosome number 21. Most of the time it's a full extra copy, like shown up in the first graphic here, where there are kind of 3 copies of 21. Sometimes individuals with Down syndrome can have that extra 21 moved and attached to another one, and that's called a translocation. That's shown in the bottom graphic here. And sometimes folks with Down syndrome can have mosaicism, meaning some of their cells have an extra copy of chromosome 21 and some don't. Down syndrome can have quite a variety of different medical conditions and can have very varied intellectual disability. It occurs in about 1 in 800 live births. And you can see from this table that there really are a wide range of medical things that can go along with it. And as I always say, each individual with Down syndrome is unique and really an individual. So these are the things we know to look out for, but not every person with Down syndrome develops all of these things. Everyone is still very unique. And getting at that, this is a graphic from the CDC, which says that every person with Down syndrome has different talents and the ability to thrive. And I really think that's true, that everyone is very unique and still, an individual that's important to celebrate. And another mantra that's quite common in the community is the idea of being more alike than different. So people with Down syndrome are more alike people without Down syndrome than they are different. And so throughout my talk, I think a lot of the things, that we should keep in mind relate to this concept. So first I'll go through pediatric health updates. There are pediatric healthcare guidelines from the American Academy of Pediatrics. These have been published for decades and decades, and they're updated occasionally over time. The last guidelines were published last year in 2022, and I'll go through just some of the latest changes with that new guideline. This is a table from the very end of that publication, and what we like about this table is that for a child of a given age, you can kind of look down the column and see what things are needed in terms of healthcare at that age. But it has recommendations for everything about lab work to do, things to counsel families about, symptoms to look out for. And so every pediatrician should be reviewing this with their patients with Down syndrome. Some of the changes in the latest guidelines is that it now talks about a genetic test called cell-free DNA that wasn't readily available at the time of the last guideline publication. It now recommends getting a complete blood count with a differential by 3 days of age. It's a little earlier than they recommended it previously, and that's to look for signs of leukemia long-term. And then they also now recommend getting anemia screening and iron deficiency screening, and that's a slight change from the type of blood work that was recommended in the past. And they also recommend that low ferritin, a sign of iron deficiency, can go along with sleep problems. So if kids with Down syndrome are having restless sleep or trouble sleeping, pediatricians might think about iron deficiency as one of the causes. Another change for older kids is that it now states that clinicians should palpate the testes, and that's because we know that boys with Down syndrome are at a slightly higher chance for testicular cancer. So that's been recommended to draw awareness to that. And then it's also recommended to think about a sleep study for all children by age 3 to 4. So that's pretty similar to the past recommendation, but slightly different. And thinking about sleep study, obstructive sleep apnea is quite common in individuals with Down syndrome. And it's really important to look for because it could mimic or worsen other symptoms like behavior trouble or learning issues. There are treatment options. So shown in one of these photos here on the left is an adult using CPAP mask. And then on the right here is a graphic showing a hypoglossal nerve stimulator, an implanted device to help with sleep apnea. And so I think it's really important that all children with Down syndrome have a sleep study because there are ways to treat it, and it could really improve their quality of life if it's treated. And that takes me to my third individual with Down syndrome to mention. Ben is a resource specialist who I am fortunate to work with, and he helps families in our clinic. He provides information and he has talks that he gives to many patients and families. And one of them actually is about sleep apnea. So that's why I put his photo here. He does a lot of things. He also works at a restaurant. He works at Fenway, and he loves all things Boston. So I'll say go Sox for Ben. And he also does lots of self-advocacy and is really just a busy, involved guy. And in the photo at the bottom, of course, is Ben and I, my very first day at the Down syndrome clinic at MGH. Some other changes in the latest pediatric guidelines are looking out for autism spectrum disorder and referring anyone who has concerns about autism spectrum disorder as soon as it's suspected, and it could even manifest in children with Down syndrome as early as 2 to 3 years of age. and also looking for symptoms of acute regression. So I think it's important to mention that diagnostic overshadowing is a common thing that has occurred in the past, and I'm going to share 2 examples of this. So diagnostic overshadowing is the concept that other conditions could be attributed to the diagnosis of Down syndrome. So behavior issues or even symptoms of co-occurring autism are kind of brushed aside and attributed to having Down syndrome itself. This is a great article by Dr. Brian Chicoine at Advocate Medical Group, if you're interested in reading more about it. So the first example is autism spectrum disorder. I mentioned you could have symptoms of autism, but unfortunately be brushed aside and thought to have it be related to Down syndrome. To address this, it's now recommended that all pediatricians should screen all children with Down syndrome for autism, just as they would for any other child. Again, thinking of that mantra, more alike than different. And to avoid that diagnostic overshadowing and not to assume that symptoms of autism could be related to Down syndrome. And depending on the literature or the article you read, the prevalence of co-occurring autism in individuals with Down syndrome is around 7 to 19%. So it's definitely something to be aware of and to be on the lookout for. In the American Academy of Pediatric Guidelines, these are the different distinctions they highlight that compared to children with autism alone, children with Down syndrome and autism can have some differences. And compared to children with Down syndrome alone, children with Down syndrome and autism can have some differences. And those are listed here. And again, if you ever suspect that a child with Down syndrome has co-occurring autism, it's recommended to have specialty evaluation to make that diagnosis. And lastly for this, I wanted to highlight the group, the Down Syndrome Autism Connection, which is a parent group that's really focused on the interplay between Down syndrome and autism. It's a wonderful group. If anyone listening to this has children with Down syndrome and autism and is looking for more resources and support. The second example of diagnostic overshadowing I wanted to mention is Down syndrome regression disorder. We've been part of studying Down syndrome regression disorder through our international patient database. And in this graphic, you can see it's made of many sites where we all work together, sharing our data and learning from our patients to then provide better care back to our other patients. We studied the features of Down syndrome regression disorder, and these are the 5 main categories. So changes in adaptive function, changes in cognitive executive function, motor changes, behavior changes, and mental health symptoms. And when we compared this between our patients with Down syndrome and regression and our patients with Down syndrome only, you can see that the patients with regression really had different symptoms than we see in our patients with Down syndrome in the blue here. In our publication on this research, we shared a 28-item checklist for anyone who's interested or may think they have a patient who has symptoms that match regression. And there also have been new consensus diagnostic criteria published since we did our work. And so this goes through a list of the criteria that go along with Down syndrome regression, again, to bring awareness to this condition and to make sure people are on the lookout if they ever see a child with Down syndrome losing skills in their late childhood or teen years. We typically perform a tiered medical workup when we see patients with Down syndrome and regression, just to make sure there aren't any other co-occurring medical conditions that could be contributing to the symptoms. And in our research, we did find some patients who had medical causes, but nothing that fully accounted for the regression that we had seen. And when we looked at patients who had a fully negative medical workup, they had many of the same symptoms as I showed you in the past graphic. We also did a screen for stressors in patients with regression, looking at the 6 months before the decline in their skills had occurred. And we saw that overall, patients with regression had many stressors and 6 times as many stressors as the control patients with Down syndrome only. And you can see some of the changes that were occurring. And we did the same. We screened for symptoms of depression in the 6 months prior to the onset of decline. And we saw the same thing, that many of our patients with regression had something positive on this depression screen, and many more symptoms of depression than our patients with Down syndrome only. In terms of treatment for regression, there are a number of approaches that have been tried, including looking for those medical comorbidities, psychopharmacology, IVIG, intravenous immunoglobulin, and electroconvulsive therapy, ECT. And this is a nice review of the literature looking at therapeutic responses. And the key points from this is that it really takes a multidisciplinary team, and some individuals with neuroimmunology findings may improve more with the intravenous immunoglobulin. But more research is ongoing in this area, and we're all still learning about this regression entity together. Next, I wanted to highlight Chris. Chris is an Ironman triathlete, which I think is wonderful. In 2020, he was the first person with Down syndrome to finish an Ironman triathlon, and he's done additional triathlons since then. He also does public speaking to share his message about positive, awareness, and also the idea of getting 1% better, which I think is just wonderful. So I wanted to highlight Chris as well. Next, I'll turn to adult healthcare. So in terms of health supervision for adults with Down syndrome, a lot of this gets back to the more alike than different mantra. So adults with Down syndrome should have many of the same routine healthcare that adults without Down syndrome should, like getting their regular screenings, being up to date on their immunizations, staying up to date with their health maintenance, like mammography, colonoscopies, cervical exams when possible, and anticipatory discussion around sexuality, dating, establishing a physical relationship with the patient and their doctor to improve that rapport and also make it possible to do physical exams, and then of course monitoring their weight, BMI, and blood pressure. There were adult healthcare guidelines specific for Down syndrome that were published in October 2020. And this was an effort of many, many people. I'll show you, this was a 13-member work group, including 11 Down syndrome experts, guideline methodologists, and parent representatives. And overall, there were many, many volunteers on the committee panels that led into this. So it was the work of many, many people. But ultimately, they reviewed the literature and graded the evidence, and they came up with these recommendations, again, shown in a really nice table where you can look through by your patient or loved one's age and see what things are needed to be done. And ultimately, these were their statements of good practice. So overall, they came away with one strong recommendation, which was to screen for Alzheimer's type dementia earlier than you would for others, beginning at age 40. And this is specifically what it says about Alzheimer's dementia and what to screen for. It gives the types of symptoms to be on the lookout for. So changes in cognition, memory, executive function, changes in behavior, personality, communication, adaptive function, ambulation, motor skills, and overall kind of if there's a general decline. So these things should be looked at annually by all primary care doctors who have patients with Down syndrome beginning at age 40. And the other recommendation was to screen for diabetes earlier and at shorter intervals, giving the high prevalence and earlier onset in adults. So this is what it has recommended here, that for asymptomatic adults with Down syndrome, to screen every 3 years, beginning at age 30, and for adults who have Down syndrome and obesity, to screen every 2 to 3 years, beginning at age 21. So that's important to be aware of and to be looking for when you're collecting other blood work for individuals with Down syndrome. I didn't want to miss that the life expectancy has really improved for individuals with Down syndrome. So in this graphic on the left, you can see that, back in the 1980s, 1990s, the life expectancy was around the 30s to 40s and slowly improving. But now this graph here in the bottom right is showing that the life expectancy is continuing to improve. And as of 2010 or so, it was approximately 50s or 60s. So that's good news and important to be aware of for adults with Down syndrome. With that increased life expectancy, though, we know that people with Down syndrome are at risk for Alzheimer's disease as they get older. And some studies show that virtually all adults with Down syndrome will have the brain findings, the neuropathology that's consistent with Alzheimer's disease by their 40s. Not everyone will have memory symptoms or be diagnosed with Alzheimer's disease in their 40s, but we see the brain findings there. And studies have also shown that 90% of people with Down syndrome will then develop Alzheimer's disease with the memory changes and the symptoms by age 65. So it's really important to be aware of and to be on the lookout for. And the Down syndrome community is very focused on this aspect, and rightly so, investing research and efforts to improve what we know about Alzheimer's disease and Down syndrome. The reason that individuals with Down syndrome have Alzheimer's disease at an earlier age is because one of the genes for Alzheimer's disease, the APP gene, is on chromosome 21. So you remember I showed you that extra copy of chromosome 21. One of the genes on there gives an extra dose, an extra copy of this gene, and that is what leads to earlier onset of Alzheimer's disease in individuals with Down syndrome. And there's been lots of literature and research to show that this is the case, so I won't go into all of that. But one particularly interesting case was an individual with Down syndrome who had most of their chromosome 21 copied, but didn't have the APP gene copied. So they only had 2 copies of the APP gene, and they did not develop Alzheimer's disease pathology or symptoms of dementia. So that's one piece of evidence that people point to that make them very suspicious of this gene. When we look at treatments for Alzheimer's disease, this is a slide showing some of the medications and drugs that have been tried through clinical trials. And overall, thousands of clinical trials have participants have been included in these trials, but none of them have had Down syndrome. And part of that is because of the age at which they enroll individuals in the trials. Since people with Down syndrome develop dementia at an earlier age, they don't always fit in the age range for the clinical trials. So we really need more studies to look at these new medications that are coming out for Alzheimer's disease, to study them in individuals with Down syndrome, and especially make sure that they're safe for individuals with Down syndrome to take. This is an article that was just published in collaboration with LumMind. And I'll mention LumMind in a minute, but I really like this quote. I think it drives home kind of the message that we're looking at, that, if you look at the Alzheimer's disease clinical trials, many of the exclusion criteria say that having Down syndrome excludes them from the trial. But people with Down syndrome are the population that's really taught us about this gene, APP, and beta amyloid. So we really need to bring the latest therapies back to people with Down syndrome and not exclude them. I really like that quote from Dr. Mike Raffi. And then the importance of including individuals with Down syndrome in clinical trials can also lead to treatment, because physicians might be hesitant to prescribe medications that haven't been studied in individuals with Down syndrome. And so then, ultimately people with Down syndrome are somewhat left behind in terms of receiving the treatment that they need for Alzheimer's disease. So I mentioned Lumine. This is a nonprofit research foundation, which is focused on individuals with Down syndrome. And it's really trying to bridge the research community in those clinical trials I mentioned in the Down syndrome community. They have a number of studies going on. They're shown here in green, and they work with many research groups and nonprofits. So this is a really wonderful group that's leading this area in terms of research and advocacy for individuals with Down syndrome and Alzheimer's disease. Lastly, I just wanted to turn to our MGH Down syndrome program for a minute and then share some resources with you. So I had to mention Melissa. Melissa is a resource specialist at MGH. She also is an office aide and disability policy advisor with Senator Eldridge. She is a wonderful public speaker. You can see that she's received a number of awards and been featured in magazines and newspapers, interviewed on TV and radio. And then I'm really impressed at her stellar alpine skiing skills. She was a member of Team USA at 2 World Games, and she was inducted in the Special Olympics Massachusetts Hall of Fame in 2010. So she's a wonderful colleague and coworker and an exceptional skier. This is my overall kind of clinical team that I get to work with, 4 physicians, many other teammates. You can see it's a big cast and crew, and we're all honored just to work in the program that we work in and to serve all of our patients. Overall, we follow many patients with Down syndrome throughout the lifespan. And overall, we have 736 active patients. And so it's a busy clinic, but like I said, we're all honored and enjoy working together. We are on all the social media, Facebook, Twitter, and we post a lot of information and resources and things about research studies that we're part of. So if you wanted to become more involved, this is one way to get more information. I also wanted to mention that our clinical and research web pages are actually a pretty good source of information and wealth of knowledge. So check those out. On the research webpage, we have a number of ongoing studies. So feel free to check those out and see if there's any that you're interested in and might qualify for. And then at the bottom of our clinical page, we have a section on patient resources, and some of them have life skills handouts, which I always like to mention. I think these are really cool and ways to help improve independence for individuals with Down syndrome. So some of the things are like how to take public transportation on your own, ways to practice this, and just kind of a worksheet to work on with friends and family. Lastly, I'll just go through some more resources. So I wanted to highlight this mental wellness book by Dr. Brian Chicoine. It used to be published by Woodbine House, but it's now available online as a PDF. It's a really good resource that talks about kind of developmental characteristics, mental health, and gives some kind of case examples that you might relate to. There are also lots of other books. These are a couple great ones: Supporting Positive Behavior by Dr. Stein, Boyfriends and Girlfriends by Terry Cohenhaven. And I wanted to mention a few podcasts. So there's a podcast by Dr. Kishore Velodi out of Down Syndrome Center at UPMC. There's also the Lucky Few podcast, which is wonderful, and then Kayla's Corner that I mentioned earlier. This is a fun app called Circles. It's a good way to kind of learn about intimacy, relationships, friendships. And the idea is there are these different circles with colors, and the closest circle are maybe your really friendly, intimate kind of relationships. And as you get further out, these might be less close and even to strangers. And the concept is kind of learning appropriate interactions for people in different circles. So that's a really good resource. I also wanted to mention the Down Syndrome Clinic in Chicago has a really great resource library online as well. This is just one example from their website about sharing on the internet and thinking about things you want to ask yourself before you share something on social media, ideas about sharing a message or photos or videos. So I think that's a really good resource too. I wanted to mention the Brain Train video series that our director, Dr. Brian Scottco, has put together. The concept of this video series is kind of practical, interactive ways to keep your brain healthy. Things like staying social, staying active, but feel free to check that out as we're all thinking about ways to keep our brain active, and for people with Down syndrome, especially to prevent Alzheimer's disease. And then I wanted to mention this wonderful healthcare tool called Down Syndrome Clinic to You, DSC to You. And this is an online health tool where you would fill out information about the health of the individual with Down syndrome. It prints out kind of information about routine healthcare that's recommended, some of the things I've gone through, like thinking about getting sleep studies. And then you could take it to your doctor, and then you make sure that your loved one is up to date for all their routine healthcare related to Down syndrome. And this healthcare tool really has a lot of information in it, lots of resources, some of the books I've shown you, but many, many more videos. So it's really a wealth of knowledge as well. I wanted to mention some parent advocacy groups because there are many, many active parent advocacy groups in the Down syndrome community. I've just shown a few here. The National Down Syndrome Society, the Down Syndrome Medical Interest Group for any medical professionals who are interested in Down syndrome, the National Down Syndrome Congress, the International Mosaic Down Syndrome Association, Down Syndrome Affiliates in Action, the local Massachusetts Down Syndrome Congress. I've been part of the other Down syndrome associations like the Down Syndrome Association of Central Ohio and the Down Syndrome Association of Greater Cincinnati in the past. And there are many, many more that I haven't listed. I can't even list them all, but these groups are so valuable to families to help provide support, especially at the time of diagnosis often, provide ongoing resources, and just to provide that network with other families who are in similar situations and have, lots of knowledge to share as well. So if any families are out there, I can't recommend highly enough to connect with your local parent advocacy group or one of the groups shown here. I wanted to mention that at MGH, we do have an elective for medical students through Harvard Medical School. I direct this course, and it's a really nice outpatient course where students connect with different Down syndrome clinics in the Boston area. We've had students from around the country come and spend a month with us. So if you know of any interested medical students, I just wanted to share that as well. And then I mentioned research briefly, but I also wanted to highlight that there really is an ongoing effort to increase the amount of research for individuals with Down syndrome. And so shown on the left is just a screenshot from the Include website. Include is an NIH initiative, which is aimed to increase funding and support of research related to Down syndrome. I also am doing ongoing research. So again, for any parents who are listening, if you would like to participate in a survey about the health of your son or daughter, feel free to reach out to us. And lastly, since it's Down Syndrome Awareness Month, and we're really here to raise awareness and to celebrate individuals with Down syndrome, I wanted to give a few ideas of ways you could celebrate Down Syndrome Awareness Month yourself. So first, you could support a person with Down syndrome on social media. I've shown a handful of influencers, but like I said, there are many, many more. And just raising their voice and being an ally for them is a great way. You could also join a buddy walk. This is a photo of our Down syndrome program team a few years ago, and there are buddy walks all around the country. So if you look at your local Down syndrome association, just going out and taking a walk, again, being an ally and raising awareness is a great way to celebrate Down Syndrome Awareness Month. I mentioned participation in research. So there are many, many ongoing studies. Check out the Down syndrome research webpage that I showed you. I wanted to mention there are also many business owners with Down syndrome, and I've shown kind of some screenshots here of the ones I am aware of, or some of the ones I know. There are many, many more. I also know many individuals with Down syndrome who do artwork or sell greeting cards. Like, there are many ways that individuals with Down syndrome are participating in their community and really being entrepreneurs. So check out some of these businesses. John's Crazy Socks. I actually put on my John's Crazy Socks today. He has many, many fun socks to raise awareness for Down syndrome. And everyone wears their crazy socks during October and on World Down Syndrome Day in March. Andy Meredith does photography. So does Kunal. Coletti has some great cookies that are really delicious. Biddy and Bose is a coffee shop. And Reeves Tees is a t-shirt company for individuals that have t-shirts about Down syndrome. So again, just a few ideas. And lastly, I showed you many nonprofits. Feel free to also donate to a nonprofit for Down syndrome if you're just looking for something quick to do for Down Syndrome Awareness Month. So I think that's the end of my presentation. I just wanted to thank you all again for the invitation to speak today. I'm happy to communicate with you by email, and I'm happy to answer any questions. And happy October, everyone.
Thank you so much, Dr. Santoro. This is very helpful. We are now at the end of the session. If you have any questions for Dr. Santoro, feel free to enter them in the chat. Before we do get started with the Q&As, we do have Zara Mir-Hosseini, our Disability Program Manager, joining us today. Zara, would you like to share a few words?
Sure. Thank you, Amy. And thank you so much, Dr. Santoro. What a great way to celebrate the month of October for Down syndrome population and the many accomplishments that your clinic has done and our population of individuals with Down syndrome. So I just want to kind of say that this is a first of 4-part disability education series that the Blum Center will host. And we are so glad that this was the first one. And I guess one of the things that I wanted to do was to really summarize what we got today from this presentation. And just to highlight some of your work, Dr. Santoro. So through this presentation, we hope that we have raised awareness about the condition, its characteristics, and associated health concerns. We feel that the healthcare providers who are well informed about Down syndrome can facilitate early diagnosis, which is crucial for appropriate medical care and intervention. We also believe that educating our healthcare professionals to understand the unique needs and challenges of individuals with Down syndrome will allow a more inclusive, patient-centered care, reduce misconceptions and stigma, fostering a more compassionate and supportive healthcare environment, which can then empower our families with patients with Down syndrome to feel more confident that their loved ones will receive quality care. And finally, knowledge sharing will encourage research and innovation in the field of Down syndrome, potentially leading to improved treatment and outcomes. So thank you so much for this presentation. And I would love to hear if anyone has any questions, but thank you.
Thank you, Zari. We do have a few questions in the chat. Dr. Santoro, we have a question regarding research. I don't know if you're familiar with this and if you have any information updates to share on a clinical trial at Mass General, specifically on neuroimaging and EEG research study of light therapy in Down syndrome.
Yeah, that's a good question. It's listed on our Down syndrome research webpage, which I could put in the chat maybe, but on the research webpage, it has all of our studies that either we're participating in or that are affiliated with MGH that we've been helping to share information about. So I would direct that person to that specific study and that researcher. I know that they're still recruiting and that they're looking for more interested participants. So I would just reach out to them directly. Yeah, great question.
Thank you. And are you aware of any new research or clinical trials regarding cognition?
Yeah. So there are a number of ongoing clinical trials. I'm trying to think if there are any specific for cognition. There are definitely trials related to regression, for example, where they're trying to look at the treatment outcomes and different types of treatment. So that's somewhat related. There are clinical trials going on about behavior and learning, so that's somewhat related. There really are a number of trials going on a variety of topics. And if the person in the chat has any questions, feel free to reach out to me directly by email and I could help connect them. The best way to find trials is really just through clinicaltrials.gov. And if you type in Down syndrome in the diagnosis bar, then you should find all the ongoing trials, and you can even select which are active and recruiting. So that's really the best resource there is to look for ongoing trials.
Thank you. You had covered earlier on regarding a survey that's available for folks. So if this participant wants the link to the survey link, feel free to either enter your email address in the chat and we'll be happy to share that with you. Or you can also email the Blum Center at pflc@partners.org and we'd be happy to share that with you after the session.
Yeah, there's my direct email in the chat. And again, any participants or attendees who are interested, have questions on anything, feel free to reach out to me. We are still recruiting for the survey, so we need more parents to fill it out. So I'd welcome anyone who's interested. Thanks.
Thank you. We have a question regarding misconceptions. What would you say are the biggest misconceptions about people with Down syndrome?
Yeah, I think some of it is that things have changed a lot over the last 10, 20 years. So I think even parents and family members often have different perceptions of what it means to have Down syndrome than nowadays versus what it was like decades ago. Nowadays, I showed the information about life expectancy. So people with Down syndrome are, really living long, full lives. And I tried to highlight that with some of the individuals I mentioned. They're all very active in their communities, have, really important jobs and accomplishments. So I think years ago that was different. And so some people may not have caught up to how that has changed. So I think that's a misconception.
Thank you. And how would you say ableism impacts the care for patients with Down syndrome?
Yeah, that's a good question. I would say sometimes families have told me that other physicians maybe don't think to ask the individual with Down syndrome their own views or how they feel about their own health, and often direct questions to the families. So whenever we see patients in our clinic, we typically ask the person with Down syndrome first. And if they need help or support from the family member, that can be a case too. But we try to defer to assuming that they can, answer on their behalf rather than presuming that the parent is the person to provide that information. So that's something I see. And I think we're all trying to work on improving that and really getting the voice of the patient with Down syndrome rather than deferring to the parent.
Thank you. We have a question regarding the APP gene. Do researchers know if the APP gene is important for other functions? Do you think it would be possible to apply what is known about gene therapy for other health conditions to the APP gene, for instance, silencing one of its copies without doing any harm?
Yeah, that's a really good question. There actually has been research in the past looking at this, but rather trying to silence the full extra copy of chromosome 21. So that has been tried, and there's often debate about how best to implement that then, if you can do it in a petri dish, what does that mean in terms of an actual patient or clinical trials and things like that? But technically that's something that could be done, and there is ongoing research in that area in the field. So that's another great question. Yeah.
Thank you. What do you see as could also be the long-term impacts of educating our healthcare providers in understanding the needs and challenges of caring for this patient population?
Yeah, I think educating healthcare providers could really start at the beginning. So in terms of, families still continue to tell me that they don't receive the diagnosis of Down syndrome in a very sensitive, positive manner. And so I think, beginning with good education on that front on how to deliver a diagnosis well is really important. And then that could extend throughout the patient's lifespan. But I think to get to healthcare providers, we really need to start educating early in training. So medical students, as well as, fellows, residents, and attendings. So I think there's a lot that still could be done in terms of healthcare education. Yeah.
Thank you. While we wait to see if there are any final questions in the chat, we actually have a question regarding studies. Are there any studies at Mass General that may be inclusive of preteens from Canada?
I'm not sure, but that person could email me and I'll look into it for sure and let them know. At the top of my head, I don't know of any, but I might be misremembering some because we do a lot of research. The Life DSR study that I mentioned with Lumine is for adults, and that could be from any location. The survey I mentioned is typically for US residents. So there aren't any that immediately come to mind, but there may be others that I can't remember. So again, feel free to reach out to me by email and I can help connect you.
And for those who are interested, the clinicaltrials.gov website that you referenced,
Yep.
is that only for US or other countries as well?
It would mostly be US, but I think others can put their trial there as well. One other that I didn't mention, the Lumine Research Foundation also has a Down syndrome clinical trial site on their website. So if you look on their website too, and I would think that would likely have international studies too. So that's another resource if you can't find anything on clinicaltrials.gov. Yep.
Great, thank you.
Yep.
Okay, so I think that's all that we have time for today's session. Thank you so much for joining us today. Before we end today's session, do you have any final thoughts you'd like to share with the audience?
Not necessarily. Thank you so much for the invitation to speak today. I really enjoyed it, and I hope everyone goes out and does something great for October.
Thank you so much, Dr. Santoro.
Thank
And
you.
And for everyone that joined us today, thank you so much. Hopefully you found today's session helpful. As I mentioned, today's session is being recorded. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Thank you so much, everyone. Have a lovely rest of the day.